Susan is happy to take this virtual transplant journey to help her decide if a transplant is the right option for her. But does she have to go through this process alone?
Of course not. Susan is not alone on her journey. The first step for Susan is to come for the evaluation. On the evaluation day, Susan will meet several people from the transplant team who will be alongside her through her transplant journey. First, Susan will meet a transplant coordinator like me who will guide her through the testing process, share information about testing, collaborate with other healthcare providers regarding her tests, act as the main resource for support and answers, communicate the team's decisions to Susan, and be the point person while Susan waits for the transplant.
Next, Susan will have one-on-one sessions with all members of the transplant team, including the nephrologist, the social worker, a financial coordinator, the dietitian, the pharmacist, and the surgeon. Spiritual or pastoral services are also available at this time or at any other phase of care. The transplant nephrologist that Susan will meet is a trained medical kidney doctor who manages or addresses blood pressure, electrolytes, and other non-surgical issues related to transplant. Transplant nephrologists help to coordinate medical issues that may impact a kidney transplant and manage long-term immunosuppression to optimize longevity of the kidney transplant. Susan will also meet a transplant social worker who will conduct an individual evaluation. He or she will direct Susan to resources for health or family issues, provide resources for recovery and rehabilitation, and assist her with any insurance or medication problems. The transplant social worker will also lead the support group for transplant patients and, if required, refer Susan to psychiatry or other counselors. It is also important for Susan to meet a financial coordinator. The financial coordinator will review insurance, so Susan should not forget to call the financial coordinator if there are any changes in her insurance. The financial coordinator will also check the type of benefits available to Susan for transplant and related medications, and help Susan understand concepts like Medicare, Medicaid, and Delaware chronic renal. At some point in the day, Susan will meet other members of the transplant team, including the dietitian, the pharmacist, and the surgeons. The transplant dietitian will assess Susan's current nutritional status and compliance and provide counseling based on Susan's specific diet needs. For example, the dietitian may advise Susan to lose or gain weight to meet body mass index or BMI standards, or increase protein take to improve albumin count. The dietitian may provide pre-dialysis diet education or recommend a modification to Susan's diet to improve lab values like potassium or phosphorus, or even put Susan on a carbohydrate-controlled diet. The transplant dietitian will also assist Susan with post-transplant diet changes. The transplant pharmacist will record and evaluate any allergies that Susan might have and review any prescription or non-prescription medication that Susan might be currently on. The pharmacist will also explain to Susan the differences between current and post-transplant medications and the pharmacist's role in Susan's post-transplant care. If Susan has any questions regarding medication, the transplant pharmacist will be happy to address them. Susan might also meet the surgeon or surgeons who will perform the kidney transplant surgery. The surgeons will determine if Susan is a suitable candidate for surgery and will also be responsible for managing anti-rejection medications after the transplant. Susan will have access to spiritual or pastoral services during the evaluation phase, as well as while she is waiting on the list, at the time of hospital admissions, or after the transplant. To avail the spiritual or pastoral services, Susan must call 302-733-1280 or ask one of the transplant staff for assistance. Before listing, Susan will also meet a cardiologist who will assess her candidacy for transplant. She will continue to be assessed annually for transplant candidacy while she is waiting on the list. Susan must see the transplant cardiologist in addition to her own cardiologist, if any. But what about Dr. Marcus, Susan's current nephrologist? While waiting on the list, Susan will still be cared for by Dr. Marcus during dialysis and for any hospital admissions. Immediately after transplant, Susan's care will be managed by the transplant team. After a year or so, Susan's care will be managed jointly by the transplant team, her current nephrologist, and a primary care physician.
Although meeting the transplant team will help you decide whether we are right for you, you shouldn't forget that the most important member of the team is you. You must be involved in your care. You should contact your coordinator with changes in phone numbers, addresses, if you move to a new dialysis center, and especially if you sense changes in your health. And you should always ask that the test results be faxed to 302-623-3825.
Susan is happy to learn that she does not have to go through the transplant process alone. She now looks forward to meeting the transplant team and wonders what else would happen on evaluation day. Continue watching to find out.